Okay, here I would like to present nursing foundations. Before starting the exact session, I want to introduce myself that I am Dr. J. Shanta Kumari, having 20 plus years of experience in nursing, teaching, and administration as well. And I like to teach students, especially nursing foundations. Though I am an experienced person, and usually you will come across that the experienced people will not go and teach the very basic or fundamentals in nursing. But I love to teach nursing foundations and nursing procedures which are very, very basic to practice our nursing. And our my principal used to say that one incident every time, that while she was traveling in a train, someone was asked who sat besides her, "What are you?" She was principal at that time, and she retired as a principal. She said one thing: "I am a nurse." Though she was working as principal at that time, but she said that I am a nurse. So basically, what I mean to say is I am a nurse, and the people who are watching are going to become a very effective and efficient nurse. And you should remember that as long as we practice nursing profession, we have to follow, or we should keep these fundamentals or foundations in nursing, like we will be learning alphabets in language, in our own language, either mother tongue or English, like the same way we are going to learn alphabets in nursing foundations. So that is the basic and very good essence of nursing foundations. So here I would like to mention that you will be coming across recently, you you might have attended TNAI conference, where the main theme is challenges. What are the challenges exactly the nursing students are facing? What are their perspectives in relation to nursing? Nowadays, every people in, or I can say that experts in nursing are the nurse leaders, are the eminent personalities in nursing. They are speaking very oftenly that we want to prepare a very good nursing professionals, a very good nursing professionals, good leaders, like that. Because you know very well that the whole world is looking at nurses. You know very well that there is lot of scope to practice nursing globally. There are many doors, not many, too many doors are open to practice your nursing, provided if you have prepared yourself with a good basics of knowledge in nursing foundations, as well as a good basis for your nursing practice. So with this introduction, I would like to start the exact session. Again, before going to the session, please do subscribe our YouTube channel. Ours is I'm very happy to share this news that we are the first people who have introduced nursing curriculum for the betterment of the nurses, or this is where the platform where you can expertise yourself with our video assisted lectures in the form of an app. And with this introduction, I would like to enter into the main course of this session, that is Nursing Foundations 1. Recently, INC has revised nursing a basic BSc Nursing curriculum, that is from year-wise program to semester-wise program. And you know very well that you have been oriented to the curriculum of revised BSc Nursing syllabus, and I hope that you have a well note of what are the subjects which are included in the first sem, sorry, and second sem. First sem includes applied anatomy, applied physiology, and applied psychology, sociology. Why they have mentioned applied, applied, applied? Why? Because many of the BSc nurses who have graduated, they are thinking that they are meant only for the tutorship or teachership, whereas they are unable to practice what are the things they have learned in the form of theory in the clinical practice. So for this reason, and after so many surveys have been done, it understood that the nurses are in lack of application of the theory what they have learned into the clinical area. This is the main objective or the main aim of revised nursing INC curriculum, that is evidence based practice is included, or competence based. I can say that competence based nursing curriculum has been included, or now we are following all the colleges, or I can say all the universities are implementing this revised INC curriculum. So for this reason, there is in-depth contents were included in each unit of the syllabus, and very depth knowledge we are going to have by having these subjects with the prefix applied. Okay, moving on to the second semester. In the first semester itself, nursing foundation 1 is there, and in the second semester, you'll be finding applied biochemistry, applied nutrition and dietetics, and then nursing foundation 2. In addition to this, to have a well awareness and to compete with other professionals and to be a globalized nurse, the software systems have been included in the second semester, that is health informatics management system. So this exclusively in the nursing area has been introduced into this curriculum. With that, you will be acquainted, or you will learn the advanced technology, how to study, how to implement, and how to apply your theoretical knowledge in the practice or in the field of clinical area. So I can say that ours is the first uh, platform where you are having this health like information management system. This is how we have introduced ourselves through digital learning system. And with this introduction, I'll start with the today's exact lesson. Nursing Foundation 1, it includes totally 14 chapters. You can see in the screen which is shared right now. So the first unit is Introduction to Health and Illness. Second unit, Healthcare Delivery Systems. Introduction to Basic Concepts and Meanings. Here, the first unit is telling about Introduction to Health and Illness. If we know what is health, before going to know what is illness, then we will be able to promote health, preserve health, and restore health. And in addition to that, we can prevent illnesses with the promotion of health and with the maintenance of health. Then second unit is telling about healthcare delivery systems. This the introduction to basic concepts and meanings of healthcare delivery system has been included in this syllabus or in this unit. Then coming to the third unit, this is a very important unit wherein you will be knowing about the history of nursing, evolution of nursing as a profession, and what are all the historical events which were added value to the nursing as a profession. And fourth unit is speaking about communication and nurse patient relationship. So communication is very essential now. At this moment we are communicating through digital platform. So this is how there are lot of advancements and changes have been taken place in relation to nurse patient relationship. So communication, knowing about the communication, the basic levels of communication, basic types of communication. In addition to that, what are the recent advancements in relation to communication and how it is influencing the nurse patient relationship, that you are going to study in the fourth unit. And fifth unit is documentation and reporting. So nowadays we are observing the most of the time is going for documentation and reporting. Human touch has become very insignificant, and machine touch has been more significant. So this is the hour of need to have human touch to develop like a good patient relationship, nurse patient relationship. This will be possible with the adoption of recent advancements in relation to documentation and reporting, which eventually conserve our time, and that time could be useful in taking care of the patient and patient to improve nurse patient relationship. Coming to the sixth chapter, that is vital signs. The name itself is telling that it is vital, very important. So, in Nursing Foundation 1, this is the unit where you are going to learn the very important basics in monitoring pulse rate, respirations, blood pressure, and the recent one is added into the vital signs is pain. So you will be learning in detail about the temperature, respirations, blood pressure, pulse, and pain that are included in the vital signs. What are the normal vital signs, normal values of the vital signs which I have mentioned, and if it goes wrong, or if the normal changes, normal values are deviating from the reference values, then what are the steps to be taken? So this you will be learning successively one by one. Then moving on to the seventh chapter, that is equipment and linen. So equipment and linen, as long as we provide good equipment and fresh linen, that would help the patient to stay very less time in the hospital. That is, short stay in the hospital will be promoted with the help of usage of technological equipment or advanced technology in case of equipment. And the linen, linen includes everything, so that will provide a comfort and warmth to the patient when he is hospitalized, he or she. Moving on to the eighth unit, that is introduction to infection control in clinical setting and in clinical setting. So here infection control nowadays, because of the pandemic COVID-19, we are very much every person, not a single person is not aware of infection control. That is the universal precaution hand washing technique. Even the ordinary, very, even illiterate people are also made aware of this practice of hand hygiene, that is hand washing or hand rubs. So this is how basically we are imbibing the infection control measures even in the public to prevent most of the communicable, like easily communicable diseases could be prevented or it could be controlled with the help of infection control. Here you will be learning exclusively in clinical settings. We are going to learn, and here this unit also is very important. It lay a foundation for the future classes, that is microbiology, including infection control, patient safety measures. And nowadays, every corporate hospital is accredited with NABH, right? So here the importance of infection control measures come into play in the clinic, various clinical scenario settings or various healthcare settings. Coming to the ninth unit, comfort, rest and sleep and pain. So how best we can provide comfort to the patient when the patient comes to the hospital, or else in different healthcare settings, how best we can provide comfort to the patient and how best we can provide rest and sleep to the patient, and how significantly we will reduce the pain when the patient comes with pain. This we will see in detail in each unit. Moving on to the 10th unit, that is promoting safety in healthcare environment. This is very important to prevent health hazards and environmental hazards when the patient is hospitalized. We can include both patient and the healthcare professionals as well. Then the 11th unit is hospital admissions and discharges. Now, from the beginning, I'm keep on telling that digitalization, right? So here, hospital admissions and discharges, when we were students, we were writing in admission register and we used to note the transferings, transfer outs, discharges. There is one admission register, one discharge register, and the other registers for transferring, transfer outs, and for referrals. So instead of using the big registers, we can adapt now to the health informatic management system where the people are entering the hospital admissions and entering the discharge summaries. Everything is has become electronized or digitalized. Okay, so that what are all the changes which has taken place or the trends with regard to admissions and discharges we'll be seeing in this unit. And coming to the 12th unit, that is mobility and immobility. There is a significant role of mobility and immobility in case of nurses while they are practicing nursing care practice. That is, when they are providing or executing nursing care activities on the clients in the form of procedures, that time when the nurse is not maintaining her own body mechanics, that is body mechanics again, the alignment in sitting posture, what is the alignment in standing postures, what are the how the body should be aligned to each other, the parts which are in the body. So by following these rules, we can promote a very good mobility in case of patient as well as nurse, and when there is immobility, how best we can helpful to come up with their immobility to mobility. Then unit 13 is patient education. Here patient education, there are incidental teachings to the patient and planned teaching to the patients. So what are all the strategies we have to follow when we are providing health education in the form of patient education, incidentally and planned one, unplanned one, incidental one. So we will see in detail when I start with the units description. Then the last unit is, it is a mandatory module used in teaching and learning practice. This 40 hours are allocated, which includes basic cardiopulmonary resuscitation procedure. So first aid, which is here after going through this or after obtaining information, demonstrations, written demonstration in relation to this mandatory module, we are also eligible to be as a first aiders if we want to practice or if we want to provide services in case of emergencies. This is the main idea behind this unit to be as a mandatory module. Okay, now we will move on to in detail description of the Nursing Foundations 1 with regard to examination. There are some weightage units. Students usually ask like what are the important questions, what are the important chapters to be known, or if we prepare few of the chapters out of 14, if we prepare a few chapters, how we can score good marks, or simply I can say how easily we can get through the exam with pass mark. That is in case of dull students. And in case of first class students, they will be still more struggling to learn the things. And instead of learning 14 units, which units, if they go through well, how best they can secure first class. And coming to the above first class students, that is whoever is aspiring for distinction, there is no weightage at all. So I used to say to my students that every unit, every subject in the nursing is very important. In the beginning of the session, if you remember, I have said that as long as we breathe, as long as we practice nursing as a nursing professional, we have to follow these basic things. So every moment of our life, even it will be useful when our own family members fell sick, and it will be useful to help our neighborhood, and it also useful to the whenever we are working in the hospitals or different healthcare settings. So that much significance is there for the nursing foundations syllabus or nursing foundation subject, and you should feel that every unit is important and every subject is important. Whenever the students are equipped with the knowledge of all the subjects, and it will be easy to apply their theoretical knowledge when they go and exactly practice in the clinical area. We'll see for the benefit of the students who are dull or who are not having the opportunities to have the good teaching, then for their sake I have given some of the weightage units. Those are the first unit, Introduction to Health and Illness, and third unit, History of Nursing and Nursing as a Profession. Fourth unit, Communication and Nurse Patient Relationship, Vital Signs. introduction to infection control in clinical setting, and mobility, immobility, comfort, rest, and sleep and pain. So these are the units where you are going to get definitely one or other question. If you are well versed with these 7 units, I usually say to my students, even to my children, you can either be perfect in last first half of the chapters in the particular syllabus, or last half of the chapters in the particular syllabus. So if you are very very thorough with that, 100% thorough, then definitely you will get pass mark. Here you should always remember that in your previous classes your pass mark is 35 out of 100, but here 50% is essential to get through your examination or to declare you as pass. So for 100 marks, you have to score 50. Then you will be considered as pass candidate. So for this reason, if you want to obtain 50 marks out of 100, you can you must thorough with all these 7 chapters, then easily you can get through your examination and you can pass. Students, remember, or the viewers, remember, every subject, every subtopic of the subject is very important, because you are dealing, nurses are dealing with the human beings, not with the machines. So each and every corner of the subject A to Z, you should thorough with that. So beginners might be thinking that why this madam is telling that this is important, and from the beginning she is telling that, like, as long as you practice until your breathe stops. So like, as whenever we take up some profession, it is job oriented, right? So we obviously enter into that occupation. So as long as you are practicing, or as long as you are in that profession, you need to come across these things. You will definitely come across these things, even the minute things, how best you can provide the comfortable bed to the patient to provide rest and sleep, and how you can attain the nurse patient relationship, that is with the help of communication or by the development of good communication skills. So every point of our life, whenever we are, either we are working or in our own family, if someone falls sick, we will be ready to take up the challenges. I have lot of or enough experiences of listening to the stories where they help their own family members and the neighborhood. I myself has conducted a labor when I visited a family next to my relatives. There was like a lady with the pains. The pains were true pains. The moment me and my mother went there, we have seen almost all crowning has been taken place. So like that, immediately we have attended, and we could deliver boy successfully. So what I am trying to say is, whatever the skills you have been learned during your student period, that will be like every cell of your body will be knowing that. So that is how you should imbibe the knowledge of your knowledge which you have gained through theory to be applied in the clinical areas or wherever the need arises. Okay, be ready and be effective in your learning as well as your practice. Now we will come to the first unit, introduction to concept of health. Coming to the first unit, introduction to concept of health. In that, definitions which are given by different, starting with the WHO, and dimensions of health, determinants of health, components of health. So all one at the same dimensions, determinants, and the components of the health. So this you will be learning, and after that, illness, definition of illness, and the health illness continuum. There are different models which are related to the health and illness. So that also you will be learning in detail. And Maslow's hierarchy of human needs. Here, this is very important question you are going to get. And health illness continuum also is an important question you are going to get. Maslow's hierarchy of needs you will be getting as a short notes or short answer question for 5 marks. And factors influencing health, this you may get for 2 marks. Then causes and risk factors for developing illness. This, this knowledge will help you to understand what are the causes for developing an illness. Then definition of illness, types of illness, and illness behavior is a long essay. And impact of illness on patient and family you may get as a short answer question. So these are the expected questions in this unit. Here I have given frequently asked questions, and a long essay are the essay which you are going to get for 12 marks. And I'll tell you what is the scheme of the examination model paper in the next few minutes. Now we will discuss exclusively about the units. What are the frequently asked questions? So here the long question, define health, explain about the determinants of health. So you should write about the definition of health, not only one definition. You can write two definitions if the marks are splitted for definition. Usually you will be getting the question like A, B, C, or like define health, which carries 2 marks, and explain about the determinants of health. This is for 10 marks. Total 12 marks. So you should write for 2 marks, one definition is enough. If they ask for 3 marks, you should write two definitions. Then you should explain in detail about the determinants of health. What are the determinants of health? So there are physical, mental, spiritual, social. So all these you will be writing. Then each one you will be explaining under each subheading. So that is how it will be completed. Then coming to the define illness and describe about factors affecting illness behavior. Again, definition of illness behavior, and listing out the factors which will affect the illness behavior, and explaining about each factor in 2 or 3 sentences will complete your long essay. Then short notes, explain about the factors influencing health. This you can list out, and one sentence you can write so that you will get 5 marks. Then second chapter, healthcare delivery systems. This includes introduction to basic concepts and meaning of healthcare delivery system, then levels of illness prevention, primary, secondary, tertiary. These are the levels of illness prevention. And levels of care, primary, secondary, tertiary care, that will be there. You know very well that primary health care, then the community health care. That means in the primary health centers, you are going to get primary health care. And at the district level hospitals, secondary health care. And tertiary, which will be referring to the super specialty hospitals or specialty hospitals. So if you see the successive side heading is types of healthcare agencies or services. In that you will be knowing hospitals, clinics, and what is the hospice care, and what are all the rehabilitation centers and extended healthcare facilities. You might be listening, or you might be hearing of extended healthcare facilities. We will be coming home care nursing. So these are the things are tele nursing care. So many things are available in the market nowadays with regard to the types of healthcare services. And here we'll see what are the basic hospitals and what is the present healthcare delivery system in our country. This you will be knowing, and hospital types, organizations and functions of the hospital, and healthcare teams in the hospitals or members and their role in the primary health centers and in the observation of real settings. This is the practical point of view. They have added that they should the students should have all sort of experiences whenever they are having the practicals during their clinical exposure. Here, the expected or frequently asked questions are: define healthcare delivery system, discuss in detail about the levels of prevention of illness with example. Here, I would like to explain because many of the students were unable to understand, and majority of the teachers are also unable to explain what exactly the levels of prevention of illness with examples. What I have observed, I'm telling you. Don't take it in personal way. So, definition of healthcare delivery system that you will be writing. Definitions always you have to write as it is. You're not going to add anything or delete anything. Then only you will get perfect marks like mathematics. Coming to the discussion in detail about the levels of prevention of illness with examples. As I listed, primary level, secondary level, and tertiary level. Primary level means here the two things are there: health promotion and specific protection. How we are going to promote health in individuals. So, by creating an awareness about the importance of promotion of health and maintenance of health by following healthy habits and healthy lifestyle. Simple example I would like to quote here: prevention of anemia will be possible at the first level, that is by health promotion. We need to educate the public and the nursing students itself, like many of the students are anemic during their study period because of many reasons they were unable to take proper diet. It will definitely, and because of many reasons, the vulnerable age group, the young nurses will comes under vulnerable age group, where we are going to lose the iron in the form of menstruation. So many times we are in deficit of HB. So how best we can improve with the locally available resources? I used to educate to the students like how best you can promote health by following healthy practices, how best you can maintain by following healthy practices like eating like instead of sugar, jaggery and groundnuts, which are the richest sources of iron, and regular intake of food without skipping the breakfast, and then whatever is available green leafy vegetables which are not costing more, so easily available resources in our local area, we can have the balanced diet. By means of balanced diet and with the practices like good lifestyle practices, there should be enough physical exercise every day, and there should be a follow of daily routines every day, going to bed at same time, getting up early. So this all will promote the health and maintain the health. You can quote this example. Then specific protection. This is all before the diagnosis. So before knowing that the HB levels are less. So specific protection after knowing that the HB levels are less, Then specifically we should concentrate on improving the HB levels by naturally intake of food in the form of beetroot juices, and then we can encourage to have jaggery instead of sugar, and other things which we can recommend to have the to improve the HB levels. That is the specific protection. We are mainly concentrating on improving HB levels. And coming to the secondary level of prevention, your early diagnosis and prompt treatment is essential. These 2 points will be covered in secondary level of prevention. Early diagnosis. So whenever there is early diagnosis, here you can quote the example of breast cancer. So whenever it is identified, the moment the every we used to educate girls like after the attainment of menarche, then the young ladies we used to ask once they complete 30 years, then every or before the 30 years after the menarche, we can ask the females to have every month breast self examination to identify early about the breast cancer. With that, we can diagnose at an early date, which will preserve the life of the individual and which will prolong the life of the individual. So by early diagnosis, we can preserve and prolong the life of the individual. And the prompt treatment, so without any stop or without discontinuity of the treatment, there should be like ongoing. Prompt treatment is very essential, and we should always see that exactly the patient is taking the treatment or not. Is there any pitfalls, and how best we can rectify as a nurse. That is the secondary level of prevention. Coming to the tertiary level of prevention, this secondary level is after the diagnosis, early diagnosis and prompt treatment. Then once there is a prompt treatment, definitely the patient will be cured or the patient will be in the recovery phase. So during the recovery phase or once the recovery is done, when the patient is getting discharged, the third level of prevention of illness starts. That is restoring the health and rehabilitation and follow up. We should explain about the importance of follow up and then referring them to the respective rehabilitative centers in case of the patients who are recovered from the cardiac bypass surgery and the patients who are recovered from any spinal injuries or spinal surgeries, and then the patients who recovered from the other orthopedic conditions or and another cancer. So in these areas we can recommend to go to the respective rehabilitation centers where they can get a lot of strength and insight, and they will be self initiative to have the regular follow up checkups. So this is how you should quote examples at each level of prevention. Then only you will get good marks, or you can get 10 out of 10 if your examples are very effective. Then moving on to the short essays in this unit, what are the main functions of hospital? This is very, very frequently asked question, and you should know what are the main functions of the hospital where you are going to work in the hospital case settings, and you should know what are the different classification, different types of hospitals. Next question, classification of hospitals, different types of hospitals, and you should refer the patients when the need arises, which hospital you are referring. This, as a health care professional, you should equip yourself with the different types of hospitals as well. Then moving on to the next unit, that is third unit. Here the very basics of nursing, history of nursing and in India and in the world. History of nursing in the world you will be knowing. Then You will be specifically knowing about the history of nursing in India, how it has started, what are all the practices in the pre-Christian era and Christian era, and after that, and what are the contributions of Florence Nightingale. And you know very well that Florence Nightingale is the founder for modern nursing, and she has started a school, and then she was the person who initiated a curriculum specifically for the nursing people, and there was training which is awarded by the certificate, like that. She has contributed a lot. For that reason she was being awarded as a lady with a lamp for her exclusive work in the Crimean War. This all you will be learning in the history of nursing. Then other area here is nursing definition. What is the nursing? According to Virginia Henderson definition, we used to learn and we used to memorize. This is a very important definition one should remember. Then concepts of nursing, philosophy of nursing. So everyone should aware of the philosophy of nursing. So total philosophy of nursing is different from each university and each institution again. So we will be extracting from the main philosophy of nursing, and it will be describing. So every moment of our career or our studies, here we are concentrating mainly on the students. So you should know what is the philosophy of the INC and the philosophy of nursing based on INC and based on your respective universities. And the objectives, characteristics of the nurse, nature and scope of nursing, and here you will nature and scope of nursing and nursing practice, then functions of nurse, qualities of a nurse, and categories of nursing personnel. And you know very well the recent like what I can say, like we have our nursing people, nursing leaders have uh, asked government that to change the nomenclature of the nursing personnel. So, because whenever the changes are there in the nomenclature of the nursing personnel, we will be getting a sort of discipline and dignity. So, this all you will be knowing in the categories of nursing personnel. And the other important subtopic in this unit and the expected question from this is nursing as a profession. First, definition of profession, and how do you say that nursing is a profession, and what are the characteristics of a profession or criteria of profession if you should support yourself that nursing is also a profession by meeting the criteria of profession. And the very important thing here is values. What are the values in relation to nursing, and what are the code of ethics and the professional conduct of for nurses? This introduction part is included here in this unit. This is a very essential. This unit is exclusively tells about what you want to become, what was there, and what you are going to become. This information will be there in this unit. So this is a very important unit. One should understand this unit whenever you are treated as a nurse or nursing student. Here the frequently asked questions are define profession, I mentioned just now, then describe characteristics or criteria of a profession, and explain nursing as a profession. How do you support that nursing is also a profession? That you should give all the criteria of a profession, and you should tell that, or you should write about how you are going to prove that nursing is also a profession. By meeting these criteria, the nursing will become a nursing profession. Then the short essays here list the direct question, list the qualities of a nurse, define ethics, write down the code of ethics given by INC. This is a direct question. Then fourth unit, About this unit, I have already mentioned that you know very well that here you will be learning about levels of communication, elements, and process of communication. Remember, students, here elements or components or the steps which are included in the communication process one at the same. Don't get confused. The nomenclature might be different, but the same thing will comes like sender, message, receiver, channel, and feedback. These are all the elements or the steps of the communication process. Okay, levels of communication, that is different. Then types of communication, modes of communication, and the factors influencing communication. I know that by this time you have got the information about these things. This is very simple to understand. And methods of effective communication, this is included uh, under separate subheading here: therapeutic communication techniques, and what are the barriers to effective communication techniques or non-therapeutic, one at the same, either barriers to effective communication or non-therapeutic communication techniques. Then professional communication, if you want to maintain a professional communication, what are the criteria to be fulfilled, or what are the things you should keep in your mind when you want to develop a professional communication skills. Then helping relationships, that is nurse patient relationship, what are the purposes, what are the phases that you are going to learn in this unit. Here I would like to mention one point, which is nowadays we are not concentrating, or we are just ignoring that point, that is we have to have a healthy nurse patient relationship whenever we are in the premises of the healthcare setting. Once we are out of that premises of healthcare setting, we are not supposed to maintain or no longer nurse patient relationship to be exist. This is very very important, students. You should make it and you should follow. If you follow, 50% of your problems will be solved. So you should learn how to maintain and how to maintain your dignity and image in the public will be totally based upon your knowledge or your discrepancy in using your nurse patient relationship once you are out of healthcare settings. Then communicating effectively with patient, families, and team members. This is also very essential. I do come across when there are doctors' rounds in the hospital wards, the in charge nurse will be just beside that going around and assisting the doctors, and then very corner the students will be standing and hiding themselves, then they will be listening. So you students, if you are having that sort of attitude, you are never going to learn anything out of these nursing rounds or patient rounds. If you are effectively communicating during the times of rounds, then whenever you are having effective communication with the patient and patient family members in relation to the disease condition, in relation to the patient needs, beyond that you are not supposed to have. And then with the team members, if you come across any problem while you are communicating, while you are delivering nursing care as a nursing student, you should immediately take that into you should communicate that to the people who are there in the team, like nursing in charge or nursing staff, you are working in the particular ward, it should be notified or reported immediately. Then only few of the problems will be solved, and there will not be any problems if you have a proper communication with the team members. So due to lack of communication, many things are messing up, and ultimately we were unable to achieve the goals. So effective communication is very important from the nurse side with the patients and with the families who are attending the patients in the different healthcare settings. And as the nurse is staying with the patient for 24 hours, it is a very important characteristic to be developed or the skill to be developed on part of the nurse starting from the student level to communicate effectively with the team members. Then the last point in this unit is maintaining effective human relations and communication with vulnerable groups, children, women, physically and mentally challenged, and elderly. So, your role or our role, nurses' role has been expanded to have the or to attend the needs of the vulnerable groups. So, we should equip ourselves to communicate effectively with the vulnerable groups in the human relations. Then moving on to the frequently asked questions in this unit is define communication, enlist the purpose of verbal and non-verbal communication, then explain SMCR model. Here S stands for sender, message, channel and receiver. So this model with the diagrammatic representation, if you could write, you will score 10 out of 10. Then short essay, what are the modes of communication? This you should know. Then briefly describe the types of communication with examples. These are the direct questions. You can answer to these questions. Then moving on to the documentation and reporting. Here you will be learning about the purposes of the documentation, reports and records, confidentiality, types of client records, then methods, systems of documentation, guidelines for documentation, do's and don'ts of documentation. Documentation is a legal guidelines for, there are legal guidelines for documentation or recording. You should follow these things when you are recording after providing nursing care to the patient in the nurse's notes. So documentation, excuse me, documentation carries a lot of weightage on part of the nurses. Even when you are a student, during that time also you are supposed to maintain the documentation to have an evidence or proof if anything goes wrong. Whenever you are documented with your initials, time and date, so it will safeguard your life and it safeguards the hospital also. So, and it also safeguards the patient. Patient safety is also very important. So, all the things will be achieved with the help of an effective documentation or good recording and reporting maintenance. Then, frequently asked questions. Here, the frequently asked questions is define documentation, or separately you will be getting the short notes here, purposes of records and reports, and what are the guidelines for documentation. These are the two important questions you will be getting in the short notes. And here in this, from this unit, you will be having mostly clinical uh, questions in the clinical settings or in the practicals. You are going to get questions in the practicals as a viva. Then sixth unit, vital signs. Here guidelines for taking vital signs will be given as an introduction to this unit. You will be learning in detail about the body temperature, like definition, physiology, regulation of temperature, factors affecting body temperature, then assessment of body temperature, the sites, equipment, and technique that you will be knowing theoretically in this unit and practically in the demonstrations. That is, there is a skill lab demonstrations, and then skill lab hours are there. You have to practice and do practice, then written demonstrations to be done to your respective teachers. So like this, here it includes totality of the body temperature, knowing the definition, physiology, regulation, factors affecting the body temperature, different types of body temperature, and how to take care of the patient with increased body temperature, that is fever or hyperpyrexia. This is also included here. The next subtopic, that is temperature alterations. Here you can see hyperthermia, heat cramps, heat exhaustion, heat stroke, hypothermia, fever, pyrexia, its causes, stages, types, and management of the fever and hot and cold applications. This practical point of thing is also included here, that is heat and cold applications. You will be learning theory here and you will be practicing in the first you are practicing in clinical lab and then you will be executing in the clinical area. Another segment here is pulse. So knowing the definition of the pulse, physiology of the pulse, again regulation, characteristics, factors affecting pulse, and how you are going to assess pulse in the on the patient, and different sites for checking pulse and the procedure. So this all will included. And here one more thing, respirations, blood pressure also, all the areas you will be studying, definition, physiology, regulation, and factors influencing respiration, blood pressure, how, what are the characteristics of the respirations and blood pressure, and what are the assessment procedures for both respirations and blood pressure. And after knowing this, how to document these vital signs, that is whenever you are checking the temperature, pulse, respiration, and blood pressure of the patient, you need to document correctly time to time to have the evidences, as I have mentioned in the previous unit. Then moving on to the seventh unit, that is equipment and linen. Here you will be knowing what are all the different types of disposables, reusables in the form of linen, like rubber goods, glassware, metal, plastics, furniture. You should know each and every equipment which are used in the hospital in relation to patient care and their sterilization techniques, methods that you will be learning in the next chapter, that is the infection control chapter. Here what are all the different materials and what are the procedures used for sterilizing or cleaning that particular reusable equipment, and introduction to indent maintenance and inventory. So as a nursing student you should know how to indent the material, equipment, supplies with regard to the patient care in the particular assigned ward. Then how do you maintain this equipment, supplies, solutions, and medicines, how you will be inventing, how you are indenting, and how you are maintaining inventory. Inventory is obtaining the supplies and the equipment from the stores, from the hospital, and then maintaining the indent registers, inventory registers, and the maintenance registers as well. So here you will be getting very short answers or multiple choice questions, and there you may not be getting the long essay from this unit. Then moving on to the other unit, that is introduction to infection control in clinical setting. So here you will be learning in detail about the nature of infections, chain of infection, types of infection, and stages of infection, factors increasing susceptibility to infections, and how our body defends against the infections. This also you will be having the information with you, so that you will be effectively maintaining your practice, or whenever you are providing care to the patient, maintaining aseptic precautions. With that we can prevent the infections and we can control the infections, and health care associated infection or nosocomial infection or hospital acquired infections. These are very, very common in intensive care units, especially medical intensive care unit, you should be very, very precautious, and you should know all the precautions, aseptic techniques to be followed whenever you are dealing with the infected patients. By learning or by having the knowledge, you can apply that correctly to the in the clinical area. Here the frequently asked question is define infection and explain the types of infection, explain chain of infection, then how you are going to prevent this chain of infection. This is essay question you are going to get, and then short questions like inflammatory response, immune response, and what are the definition of nosocomial infection, and discuss about the nosocomial infections. This at the introductory level you will be learning here. In detail you will be learning in the second year, that is in the third sem. In this unit again the concept of asepsis, that is medical asepsis, surgical asepsis, clinical asepsis, and other very important in the clinical scenario. Then ninth unit is comfort and pain. So here you will be knowing what is definition of comfort and what are the factors influencing the comfort. And in the same unit, you are going to learn about different types of beds. How do you promote comfort to the patient? Discuss. This is the question you might be getting. So, whenever they ask, how do you provide comfort to the patient? You should, in the long essay, you should start writing what is the definition of comfort and what are the various comfort devices we are using to promote comfort to the patient. And then you should write about the bed making procedure. So like this you have to divide your answer and organize your answer, then only you will get full marks. Otherwise you just mention that only bed making because you are providing comfort to the patient by doing bed making. So that is not the only one criteria. There are many criteria, or there are many comfort devices which will provide comfort to the patient. And you may get here this unit, in this unit you are going to get mostly practical questions in the viva. During your practical time you are going to get viva questions from this unit. Why? Because it is related with most of the nursing procedures. Then another important long essay here is sleep. Define sleep, write about the physiology of sleep, and as a nurse, how you are going to promote rest and sleep to the patient. And in the short answers, you may get sleep disorders. Then another important essay question from this unit is pain. Define pain, explain about the physiology of pain, and discuss non-pharmacological pain relieving measures. This is the question you are going to get. You should be able to answer what is the definition of pain and what is the physiology of pain, then what are the non-pharmacological pain relieving measures. One important thing here, non-pharmacological, for example, is position. Position is a very best non-pharmacological pain relieving measure. So you should know what are the measures, and that description you have to give in this question, to this question. Then 10th unit, promoting safety in healthcare environment. So physical environment is very essential. You should know what are all the normal temperature, humidity, noise, ventilation, light, odor, pest control. These are all the, as a ward in charge, they are responsible for providing safety in healthcare environment. As a nursing student, you should well aware of these things. Then when you are exactly practicing in the clinical area, you should see that all these minimum things were able to meet by the patient or not. If anything you could do at your level, you can do. And if not, you can inform to the higher authorities or the ward in charge, they will take care of this. Then reduction of physical hazards, fire and accidents. This is a very important thing the student nurse should know, and false risk assessment should be known. Then role of nurse in providing safe and clean environment. So patient unit, if you see the patient unit, bed, locker and chair or stool, that whole area will be considered as a patient unit. Whenever you are practicing or whenever you are providing care at the patient unit area, you should see that all the patient unit area is either neat and tidy or promoting safety to the patient. The safety devices, if unconscious patient is there, we have to provide side rails and different types of restraints in cases of semi conscious patients and patients who are disoriented or with the head injuries. Like that, there are many things comes under these safety devices. So all the things, all the theoretical information you should know, and you should take care whenever you are exactly working in the clinical area. Then here the questions you will be getting: role of nurse in providing safe and clean environment. Discuss the role of nurse in providing safe and clean environment to the patient in hospital or healthcare setting. That is the essay question you are going to get. And the short questions you will be getting: how are you going to assess fall risk assessment? That is the one thing. Then safety devices, what are safety devices? Name the safety devices and explain any one of that. So like that you will be getting the questions in this unit. Then 11th unit, hospital admission and discharge. Here direct questions will be given like essay question. Write about the procedure of hospital admission and discharge. That you will be asked, and you may ask short notes like types of discharges. You can get the short answer question. And then what are the roles and responsibilities of a nurse in relation to admission and discharge? Straight questions you are going to get from this unit. Then 11th unit, mobility and immobility. Here elements of normal movements. So practical point of view, how to maintain your body mechanics, principles of body mechanics, and what are the normal movements. This you might have learned in your anatomy and physiology. There, like normal movements, alignment, posture, joint mobility, balance, coordinated movements. That knowledge you should integrate here. This is lacking. Here I would like to mention this a significant point to be noted, that integration of the subjects, whatever you have learned, the foundations, related subjects, that is the medical subjects, anatomy, physiology, that basics you are supposed to apply here in this nursing foundation. That is the integration of the subjects and comprehensive understanding of the subject. Then principles of body mechanics, straight away there are principles. Then factors affecting body alignment and activity. Then exercises. The exercises, practical point of view, what are the passive exercises, active exercises, how these exercises are playing an important role in promotion of mobility to the immobilized patients. Then effects of immobility and maintenance of normal body alignment activity when we are transferring the patients, shifting the patient from wheelchair to bed, bed to wheelchair, and from bed to stretcher. So these are all the practical procedures you will be learning in this unit. So range of motion activities, muscle strengthening exercises, positions, moving, lifting, transferring, walking. helping the patients in ambulation, then care of the patients with immobility using nursing process approach. So care of the patients with cast and splints. So here the expected questions or like frequently asked questions: define body mechanics and describe the principles of body mechanics, or explain the principles of body mechanics, and write about the exercises, short notes, active exercises and passive exercises to be written in that. And then mostly you will be, this unit also is contributed for the practical area. You will be learning all the procedures in the skill lab. Then 13th chapter, it is a direct question you will be getting. What is patient teaching? Write about the importance of patient teaching in clinical nursing care or in nursing practice, and what are the purposes, process of patient education or teaching. Then, or else you can get discuss the integration of nursing process in patient teaching. So here nursing process you will be learning in the like a nursing foundation 2. I'll be explaining in the nursing foundation 2, like how to apply nursing process, how to integrate nursing process when you are giving patient teaching. So a straight question you will be getting in the short notes like patient teaching, its importance or purposes. Then 14th unit, this you may get the questions, direct questions like what is the definition of first aid management and what are the basic principles of first aid, then rules of first aid, what are the qualities of first aider. This direct questions you are going to get. And most of the wounds, hemorrhage, shock, all the things, first aid management of wounds, hemorrhage, and shock, then musculoskeletal injuries, first aid management when a patient with multiple fractures or the like that, or transportation of injured person, how you are going to transport to the medical aid, and what first aid you are going to give in case of respiratory emergencies. And every student nurse should have idea of basic CPR, and by practice they should be able to demonstrate the team demonstration in case of CPR. Basic CPR should be known by every nurse, student nurse, and unconscious care. All the mentioned topics here, you should write only first aid management. Don't go on narrating nursing management or something like that. So you should straight away write what is it, what is burns, what is scalds, and what is poisoning, what is bite, what is first bite, then what are the community emergencies, and what is the role of nurse as a first aider, or what is the first aid management or the role of first aider in community emergencies. Like that, the questions will be posted to you. So you should be able to write or answer to the questions, and you may expect the short questions from this unit and the MCQs. And here are few questions which will comes for 15 marks or 12 marks or 13 marks, depending upon the pattern of question paper. So question paper will be discussed in the second session, that is Nursing Foundation 2 webinar. I am going to give complete picture about the examination paper and how to answer and what to answer when the question is posed in different ways. Here, this I already explained to you what are the expected questions. We will, you can have this content in relation to the whatever I have explained. That lecture note is available in this PPT slides. We will switch on to MCQs. This is newly introduced into your question paper. What is the purpose of nursing code of ethics? So you will be given four multiple choice uh, answers. You should select one which is 100% correct among the four questions. So for the past many years, there was no MCQs in the question paper, but now it has been included in the question paper. Either 6 marks or 7 marks were allotted for the MCQs, and then you should, if you are well versed with all the units, then you will be able to attempt to the MCQs. Here I would like to mention that for each and every subtopic of the units which I have mentioned just now, video assisted learning is possible with our Prakara learning app. And then the another important thing is after video you will be getting the lecture notes in the form of study material, and you will be also having the key terms in the separate document, and then MCQs. So you can assess your level of understanding, how far you have got the information about that particular topic. That can be assessed by yourself by having the self assessment tool in the form of MCQs. So this will be possible with the help of our app. I would like to introduce our app. Here you can find the information in relation to our package, which is meant for the students who are writing their examinations, semester exams, that is first and second sem, like in the form of MLP. So MLP, mini learning practice. So here you are going to get the information about the first semester, second semester. The subjects are listed here. If you see the right side of this in the tables, then on the left side you can see the features of this app, that is video lectures, student notes, key terms, and self-assessment tool. So I would like to encourage you to go and have this subscription. This is only for 149 rupees. Nowadays, it's not a big amount because you are maintaining your Android phones. So I think that it is not so expensive to have this, and really it will help you to get good results, and it will be very helpful to you to look into the each and every corner of your subject from A to Z. We have prepared these video lectures, student nurse, key terms, and self-assessment tools. These videos are for 10 minutes or maximum 15 minutes only, starting with the minimum 5 minutes. So you can watch this, and you can, by listening to that and by looking into your student notes, you will be able to have a better understanding about the concept, and immediately after listening you can assess yourself then and there where exactly your level is falling, or the standard of your understanding, and how many marks you are going to secure or obtain. Based on that you can improve yourself with a less expenditure and with a more subject or more information. So with this, I conclude my session that please do subscribe our YouTube channel. And then my sincere advice to all the students and the viewers, keep on looking into our postings, have active, be active, notify or watcher of our WhatsApp, and then you will be having a lot of notifications. And if you have any questions to be clarified, that also can be posted in our WhatsApp group. And then we are here to help you, and we always at your service. Thank you for your patience listening. Thank you.